Hi, I'm Dr. Mandy Wyant with Family Chiropractic and Wellness. Lauren here is going to be our model. She's our chiropractic technician in the office. And we're going to talk about some common low back, hip, and lower extremity conditions that we treat here in the office and how we treat them. So for a lot of people, we like to work the low back. There are a lot of different ways to work the low back, but I really like to use what's called Flexion Distraction. So this piece that she's laying on, it moves just like this, kind of up and down. And we can hold throughout the low back and get a good decompression. So you can open up those joint spaces. This is a really good technique for when there's arthritis in the picture. It's good for when there's a disc condition. So a lot of people think with a disc bulge or a disc herniation, there's not a whole lot you can do, but there are good techniques just like this that you can use to kind of reposition that disc and get it off of a nerve that it might be affecting. We can also add some side-to-side movement. So this is just a good decompression, good stretch for the low back, because a lot of people sit all day long and that low back gets really compressed. So we're going to lock this piece. Let's talk about hips. So a very commonly tight muscle in the hip is the piriformis. It's a muscle that runs from the sacrum out to the hip. When it gets tight, it pulls, and it can cause, if you look down at your feet, you might see that one foot turns out a little bit more than the other one, or that knee might be hurting because of that. It usually is tighter on the dominant hand side because it just builds up over time. Most people think of their dominant hand, but you also have a dominant leg, and that can build up tension over time. When this muscle gets tight, it can turn into a lot of different conditions. Bursitis at the hip, lower back pain, sciatica going into the leg, and then also very commonly conditions at the knee and at the foot because it changes the mechanics of that leg. This is an area that I work on most people and a lot of my athletes, especially the runners and people who tend to use this area a little bit more. The way we can work on this as far as muscle goes is we can do just like this. This is called muscle release technique, just getting in there and kind of lengthening out that muscle. It's usually, like right there's probably a little sore on Lauren because I can feel it's tight and there's a trigger point. This is just a great way to get some better movement into this hip, and it usually accompanies the adjustment really well too. So into the adjustment, there are, again, a lot of different ways you can adjust pelvis, hips, low back. I tend to use either manual adjusting. So for Lauren, we would lay her on her side and it would be kind of a rolling type of adjustment where we would drop a little bit. That's the one where there might be a little bit of a popping noise as the joint releases. Or again, if someone doesn't do well that way or they don't like that way, we can use what are called drop pieces. So drops come up, and they're called that because they drop down. Really the worst part about these is the noise, so it's going to be a little noisy, but they come up, and you can use those to get different motion, like through the pelvis and hips like that. So they go right like that. So that's just another way, kind of in the middle as far as force goes, to get movement and get better symmetry through that low back hip area. So if you or anyone you know is suffering from low back pain or anything into the hip and leg, we'd be happy to talk and see if we can help.